Access to proper personal protective equipment has been a challenge for many a Kenyan, more so in rural and informal settlements in the battle against COVID-19. But a community-based organization in Kisumu has joined the fight against the disease by distributing free masks to locals and frontline workers in the face of growing community transmission in the lakeside city. Oko Okusa has that story.
The rattling of sewing machines greeted us when we got to Kitimikai Technical Training Institute here in 7 sub-county. 8 a.m. it was, and already the facility was alive and beaming with activity. Pamela Mary and 9 other young women are the people behind the cutting and sewing witnessed here daily.
Kwa sasa tunashona mask, na hii mask tukishashona tunalipwa. Tukishalipwa hiyo pesa yenye tumepata naweza enda huko nyumbani nijisaidie. Naweza nunua vitu vyangu, nisaidie familia yangu bila kutegemea yoyote.
Pamela and her colleagues are beneficiaries of a tailoring course sponsored by a local community-based organization that empowers young women in this community.
We approach community programming in different ways. But also being a community program, you also cannot afford to lie low when there are things that need to be done. For example, now there is the COVID-19.
And with that, the mask-making idea was conceived.
We have engaged our program beneficiaries, particularly the adolescent girls and young women whom we have trained in economic empowerment, to engage in making of face masks. For essential service providers, that means people who are working in the community to continue supporting essential services, for example, community health workers.
They gave us masks, over 5,000 masks. The masks served the security team, that is the police, all the police posts. They served up to the village elders, the chiefs, the assistant chiefs, and we even had some also for us in the office, just in case a client comes. That time, you know, masks were very scarce. Yeah. So up to there, we are very grateful.
With the current production, we are targeting the teenage girls because they're at home and they don't have a source of income, and they're complaining that they do not have masks and they can't afford, and their parents as well cannot afford.
However, the war on COVID-19 is not the only battle Pamoja is battling. HIV/AIDS and teenage pregnancies are still under its radar.
As a program, we have been championing pre-exposure prophylaxis for HIV, that adolescent girls and young women who are at risk of contracting HIV are encouraged to enroll into to prevent their exposure to HIV.
For us to have the girls registered in our program, we have to know their HIV status. So during this COVID-19 pandemic, we are working closely with the Ministry of Health, the Interior Ministry, and the CHVs, that is the community health workers. We distribute oral self-test kits at household level.
The Pamoja has also provided us with the PrEP that protects the young girls and women from contacting HIV/AIDS.
In our comprehensive care centers, the children who are HIV orphaned, most of them have been enrolled by Pamoja for support.
In a bid to keep the school-going girls busy and away from the allure of sexual predators, Pamoja has introduced a number of income-generating activities for the girls in the village.
They come together, they make stuff so that they cannot be idle at home. Bead making, we teach them, they know how to make them so they cannot be idle.
Now we are not so much idle. We have something to do. As we preparing shop, you know that I'm going somewhere to collect the money and go to the group, so we are not so much idle.
Besides providing the girls with the income-generating activities, Pamoja has also introduced what has come to be known as the Dignity Park.
We give it out throughout the year. Like we can do the first batch for that can take the girls for 6 months, and then we do another batch that can take them for another 6 months.
Pamoja has also been offering for us sanitary towels, that has helped girls not to be lured by men in search of money to buy sanitary pads.
As for me, I've benefited from the cash transfer of Pamoja. They have helped me start a business, a small business of my own, because I used to rely on my parents to help with some things. But now, as for now, I'm independent. I can even promote my mom in some way.
Pamoja CBO was established more than 10 years ago, primarily to respond to the HIV pandemic and its effect on the community. During this period, the organization has expanded its mandate to include economic empowerment of the community by leveraging resources. Oukokusa NTV, Kisumu.